osteoporosis. So what is it all about?
It definitely starts with having a poor posture, which is something which you have to address. Prolonged hours of sitting definitely is one of the most common causes. Sitting silently at your desk or in the confines of your home, you're actually losing bone and you are taking small steps towards actually getting a fracture. So I'm yet to find a family where there is no person who is facing knee pain.
That sounds very serious and very dangerous, like more than coronavirus which just hit us. Hi everyone, welcome back to Take It Easy with your DiagnoEasy, your go-to podcast where we discuss all things fitness and wellness. Today we have Dr. Kartikeya Desai, orthopedic and joint surgeon. And hi doctor, how are you doing?
Hi, I'm doing great. Thank you so much for having me. And I hope I can contribute to this great journey towards wellness which you guys have started.
Okay, so before we dive into today's topic, I was just curious bit about osteoporosis. So what is it all about?
Okay, so that's a very serious topic to start with. So osteoporosis is a silent pandemic which is going through across our society. And this is actually nothing but, simply speaking, it's loss of bone mass. So while you are sitting silently at your desk or in the confines of your home, you're actually losing bone and you are taking small steps towards actually getting a fracture. So that is what is osteoporosis.
That sounds very serious and very dangerous, like more than coronavirus which just hit us, right?
Yes, it is serious. The more serious part of it is that it is mostly comes across as very silent.
Yeah.
At times there are no active symptoms, and most of the times we diagnose it at a time at which finally a patient already has had a fracture.
Okay.
So that is the most serious part of it.
So any effect, like anything which we do on our day-to-day life which can be a contributing
Definitely, most definitely. So in fact, you hit the nail on the head. This is a disease which is better prevented than cured, because by that time we already have had a fracture and it causes gross disability to the patient. The patient has to stay in his house, cannot go to work. So yeah, in fact, there are some key points which you can take care of and try to prevent getting into such a situation. It starts with, of course, having a healthy lifestyle. It might sound generic, but it is very specific to this disease. You have to do weight training, some strengthening exercises, ensure you get enough of your calcium and vitamin D, eat enough green leafy vegetables, some fortified foods help, and if required, go and seek medication help from a doctor. So that is what you need to ensure that you don't land up in such a situation.
I better keep my gym up and right all the time.
Absolutely.
So let's dive into today's topic. So first of all, we would like to draw attention towards, we'll be talking about the pains which we come across. So first of all, we'll start with back pain. It's a very common pain we all come across.
Right.
Either it can be like I'm sitting here all day on the desk, so I do have very worst back pains. And if you're lifting groceries and everything, so what are the reasons which causes back pain?
So first thing which I want to tell all the viewers is pain is not normal.
Yeah.
So it's lower back pain. Most people try to brush it under the carpet as something which is happening every day, but there is no reason to believe that so. And of course, I agree with you completely that it's such a common phenomenon. In every house, you will at least find a member or two across ages, across different walks of life, which have back pain. So yeah, definitely this is something which is very poignant to talk about in today's day and age.
So like we all work like 9 to 8 hour shifts every day. Basically we are sitting on a chair.
That's
but
right.
Yet we are having so much back pain. Like why sitting on a desk is causing so much back pain?
So prolonged hours of sitting definitely is one of the most common causes. It definitely starts with having a poor posture, which is something which you have to address. And then there are other parts like nutritional deficiencies, lack of exercise. Okay, people are not paying enough attention to their core. So these are reasons which are causing the back pain in today's day and age. There is practically no exposure to sunlight.
Yes.
So this is one of the reasons where some of my patients are now coming up with back pain at a really low age, as low as 18, 16-year-olds coming out with back pain. So yeah, and of course osteoporosis most definitely, but it affects the higher age group actually.
Okay, so what are the prevention methods we can take up for back pain?
So more than prevention, lower back pain is more a behavioral thing. So
Okay.
there are some things which you have to add in your daily lifestyle, and this will really go a long way. Small changes, but if you can enact them with discipline, then this is really going to help you in the long run. So definitely sitting in a singular posture for a long time is a problem. So you have to start by getting a good support, or get a good chair if you have a sitting job, and ensure you get in some at least 20-30 minutes of exercise every day. What you can do is that you can move around after every 2 to 3 hours to ensure that, do some stretching to ensure that all the muscles are healthy. Okay, so essentially what we want is to, it's like oiling a machine, right?
Okay.
So you don't want it to sit idle. Your musculoskeletal system is a very live and kicking machine and needs to be oiled. So if you don't do that, then you're going to land up with symptoms.
Okay, so next we'll be talking about knee pains. I am specifically very keen about knowing this thing because I love to dance, and I had to leave dance for a very good amount of time because of knee pains and everything. So this patella used to move out
That's
from
right,
its
yeah.
place. So what is knee pain? Let's start from there.
So again, very very common. I'm yet to find a family where there is no person who is facing knee pain. So knee pain causes are very different and they are very age specific. So in youngsters, like something which you are facing, it is usually related to overuse injuries, right? And maybe it was a cause of dancing in any accident or any trauma. So we all have very active lifestyles, right? So there is a good chance that we might injure some ligament in our knee, or we
Okay.
might pull a muscle, and this causes gross morbidity. Okay, and why I keep on saying this is that unlike other diseases, this is not something you can ignore, because the knee pain is going to nag you every day,
Yes,
right?
every day.
And it brings you down. It also affects your psychology. So definitely knee pain, very very important. Great. I will be very happy to answer your questions on knee pain.
So what are the daily routines which might affect and contribute towards knee pains and everything?
So as I told you, it's better to divide knee pain as per as the age group.
Mhm.
So in a youngster, we are looking at ligament injuries, bad posture, improper exercises, and trauma. And as far as old patients are concerned, or older patients are concerned, we have a very serious condition called osteoarthritis. This is affecting most of our parents actually nowadays. This is when the cartilage of the knee has started to erode off, and it's causing a lot of pain. So the prevention is also cause specific. For old patients, we suggest some supports, and of course knee strengthening exercise will help all the patients who are suffering from that. And these are very simple exercises actually.
Okay.
So this is something which should be there in everyone's routine, right?
Okay. Will you be suggesting one or two for the viewers?
So we do something called quadriceps strengthening,
Okay.
and these are exercises which you don't need to go to a gym, like
Okay.
basic squats, lunges.
Okay.
Okay, this is just trying to ensure that all the muscles of your legs are well balanced.
Okay.
So imbalance is the reason of this kind of knee pain, right?
Okay.
So, and without you knowing, this is one of the most used parts of your body.
Oh, yes.
So
absolutely.
if you don't take care of it, it is going to give you issues.
Just one question. So in our gym, in anywhere, the trainers always emphasizes on putting on a kneecap. Is this really essential if you're doing a leg day?
Most definitely not. Okay, if your muscles are good enough, God has given you a good knee, you don't need anything.
Okay.
But of course, once there is an onset of osteoarthritis, or once you have pulled a ligament, a kneecap really helps keep things aligned.
Yes.
But I would really suggest that everyone should seek medical help, ensure, diagnose what is there in their knees before starting exercising, right?
Okay. Thank you. So let's move on to the next topic, which is wrist pain.
Right.
Not very common, I think, but yet very silently works, I think. So what is all about wrist pains?
So nowadays we are seeing a new phenomenon. Many of our young patients are coming up with wrist pain, and this is because sitting at the desk typing, or maybe just doing their Instagram on.
Now everyone is on the phone. They
That's
are all
right.
the time on
That's
the phone.
right.
You
That's
cannot
right.
live without
That's
that.
right. So the answer lies just there. These are all new phenomenons. Humans never used to spend so much time
Yes.
on screens. So very clearly that is something which has to be addressed. You cannot go on. Very young school-going people are now spending hours on the computer, and you should find time every 15-20 minutes to do some basic stretching.
Okay.
and ensure that there are like very specific exercises for your wrists also. And in old patients, the most definitely wrist is one of the most common fracture areas also. This is because you might actually come up with the weight of the body on your wrist. So these are things which you have to address with, on the core it's about addressing the nutritional deficiency, ensuring movement and mobility, and giving adequate support to the joints which we are talking. Once you address all of these three, you should be in a good place.
Okay.
Yeah.
So what, any preventions that we might be looking for wrist pains and everything?
Nothing specific. The prevention is that don't overuse them, right?
Okay.
Ensure
So
that you
yeah, definitely
exercise.
not using much phone.
Definitely,
after
there
work
has to
hours.
be a cap. There has to be a
Yes.
cap on that, right? There has to be a cap.
As we are wrapping up, so
That's right.
so what would be the key things, feedbacks you would want the viewers to take back from today's session?
Yes, I think the key take-home points for today is, as I said, really start thinking about your musculoskeletal health. It's something which is slowly, by the day, by the minute, taking you towards like a medical catastrophe. And take enough rest, do changes in your behavioral things, do some lifestyle modifications, manage your weight, be nutritionally fully component. That's it.
Okay. So thank you everyone. Thank you for tuning with Take It Easy with DiagnoEasy. So make sure you take rest, take good care of your health, and definitely listen to your body. We'll be back with another episode of Take It Easy with DiagnoEasy. Till then, stay tuned with us. Thank you.